Welcome back to Medical Associates Health Check. As you can see, it is Christmas season here, and we have a hot topic for you. It is gallstone disease. My name is Dr. Laisha Selvaraja. I am the clinical administrator and head of accident and emergency at Medical Associates, and my co-host.
I am Dr. Bristow, and I am the founder of the Concierge Medical Clinic, and I'm a specialist physician in internal medicine.
So, Chris, today we're talking about gallstone disease. Mm-hmm. As you know, this time of year, we see it like every other patient almost.
Yeah. The food, the fun, the flavor could all lead to some trouble.
And back by popular demand, we have Dr. Yadish Singh with us.
So thank you very much for having me again, especially at this festive time.
Yes.
Nice, Dr. Singh. I mean, we had you before, but I mean, just run through, what's your special interests? I mean, right. Gallstones, what?
Yeah, I mean, I'm a surgeon, a laparoscopic surgeon, and we do operations or surgeries using very, very small incisions and sometimes even scarless incisions where you don't see any scars in the abdomen. And we are able to remove things like gallbladders, gallstones, cancers.
There's a picture of somebody who might suffer with gallstones. Long time when you read your surgery textbook or your medicine textbook, they will tell you the
picture
lineup of things that put people to we're not cussing as F is what help us to remember
the 4 F's.
Yes.
But Dr. Singh, just go through the F's and maybe paint the picture of what somebody who suffers with gallstones might look like, what conditions they may have that predispose them to having gallstones.
I mean, yes. I mean, as I told you, I'm a lecturer at the university, and I teach all my medical students. They must know the F's.
They must know the F's.
They must know the F's. And I mean, the being female at the age of approximately 40 years old, and we say fertile, so they're still childbearing. Mm-hmm. We use the word FAT, but we really mean overweight.
Right.
And those are some of the F's that typical patient that will have. Mm-hmm. Yeah.
But not always should gallstones fit that picture, because correct. I mean, you could categorize gallstones in two different ways really. If the gallstone is based in cholesterol, or if the gallstone is a pigment stone,
sure,
you might just draw in some clarity to the two types that you would see, and you might have a different habitus or a different type of patient coming to you with
correct. And also the age is different now, because we're seeing, just like in a lot of disease processes, we're seeing gallstones even at an early age. We have seen gallstones in teenage kids. I've known a case that was published in a child less than 10 years old. But getting back to your previous, I mean, gallstones could be classified into different types. I mean, the most common type being cholesterol stones that normally are found in patients who are a bit overweight, in the 40s, and being female. However, there are conditions that predispose you to other type of stone that you call pigment stone. Right. These are the color, they normally black in color, and they are predisposed. They're formed in patients that have blood disorders, such as, I mean, the most common you probably know is sickle cell disease, but they have other blood disorders that could form gallstones.
Yeah. So essentially your sickle cell patients with gallstones could be those younger patients, correct, children and stuff like that.
Yeah, and they don't fit the body habitus profile. They normally
because most sickle is usually very thin, very
overweight.
Yeah. But I think that's the thing. In medical school, you're taught to think of this particular person. So now that you start practicing, we have to start thinking outside the box, because it's not typically the 4 F's, as you want to put it. Yeah, I saw a young male not that long ago. He wasn't overweight. In his early 30s, and he had gallstone disease.
Sure.
Yeah. And the other thing about gallstones is that it can lead to something called cholecystitis, which is inflammation of the gallbladder, and that's when it becomes very painful for people, and people will start to seek help.
Yes. A lot of people walk around with gallstones, and they don't even know that they have it. So about 20% of our population will have gallstones. And if you want to choose 20% of that 20%, they actually will have symptoms, and the symptoms exactly what you said. And the most common time, especially at this time of the year, Christmas, when they eat all these fatty foods,
rich foods,
things that we love, but they have tummy pains, and it normally happens right after they eat probably about a half an hour after,
hour,
and they
yeah.
get severe abdominal pain and nausea and vomiting. And that's, they would probably have had gallstones for years, and suddenly they get this abdominal attack.
And that pain could come in some nice different.
Yeah.
How they describe the pain is usually a unique type of pain.
Yeah.
You know, some patients might say, I feel a pain in my chest, doc, or I feel
Yeah.
a pain in my belly, and I feel this pain going wrong in my back. You know, it's a nice classical description, really, because where the gallbladder is located.
Yeah.
Also. So the gallbladder is in your right upper quadrant, as you would say. And it, based on the type of, how severe the gallbladder disease is, could it, you know, define the types of symptoms you would really experience?
Well, it depends on the not so much the site. I mean, the typical patient will have the central abdominal pain more on the right side. However, I've seen patients with pain on the left side. I mean,
Yes.
it's very uncommon, but I've seen patients pain on the left side. They may present with complications of gallstone. They may even present with something called pancreatitis.
Right.
You all think pancreatitis is caused by alcohol, you know, but actually the number one cause in the world of pancreatitis is gallstones. And these are very, very small gallstones. And gallstones come in very, very sizes. They almost like little sand. And those are the ones that are called pancreatitis because they can actually flow through the gallbladder and interfere with the pancreas.
Yeah.
And then there are large gallstones that they call severe abdominal pain because it can't move and the gallbladder gets expanded and gets swollen up and inflamed. And they may present with fever, and some may even present with yellow eyes,
Right.
jaundice.
Jaundice.
Now, if I
not John,
remember
not John
correctly-
Dozer, it's jaundice.
You know, jaundice.
You took out the largest gallstone in the world, if I'm not mistaken.
Yes, in 2018, we actually took out the largest gallstone. Well, it's approximately, and I have a little surprise for you for
really?
Christmas. And this is our Christmas bag. And imagine that you're walking around with a gallstone the size of a zabuka in your abdomen.
Your gallbladder isn't even that big.
The gallbladder actually can expand,
Yeah.
stretch. But no, it's not the typical size.
Yeah.
So this young lady, she was in her 70s, and she actually got diagnosed with gallstones in her 40s. And she didn't, it probably wasn't so much pain, so she didn't operate on it. But when she was around 70, it started to bother her. And when they imaged it with the ultrasound and CT scan, they found that the stone was as large as this. When I operated, I didn't realize that it was the largest gallstone in the world. But when we did the research, and we actually got a publication of this, and this was published, and it was on the media and stuff, and it is the largest gallstone in the world.
That's
And since then, I've removed approximately 5 more gallstones, not this large, but
But still mega.
Pretty-
mega
big.
gallstone. They're all greater than 5 centimeters.
But you know, like, I mean, yeah, gallstones is a big deal, right? But are there any hallmarks that, or even, you know, good words of advice you could drop for your patients who might be struggling with gallstone disease, especially now? You know, what they could do to really help themselves manage gallstones, or even find out that they might have gallstones.
Yeah, I mean, to manage it, you need to know what the diagnosis is because there are a lot of other diseases that mask gallstones.
Yeah.
So a lot of patients may walk around and think that they have reflux or heartburn.
No, that's true.
And that's a common thing, and they wouldn't go to the doctor for that. And they just take antacid, over-the-counter medications. They go to the pharmacy. However, if you have any symptoms that are similar to gallstones, what you need to do is to get an ultrasound.
Right.
An ultrasound is the number one diagnostic tool for gallstones.
Good. Yeah, so I mean, get your ultrasound. You need to get checked by a doctor,
Yes.
and then based on that, based on the findings, then you know what might be the best
Yeah.
treatment. You know, to have.
So I mean, one of the easiest way to prevent an attack of gallstone is keep away from all oily foods, any food that is fatty.
You know,
Now, to tell a patient that, it's almost like committing them to death.
Yeah, no one's going to
'Cause
really
everything
follow
has
that, are
oil.
they? Realistically, because when we tell patients you can't have butter on your toast, you can't have dressing on your salad,
Yes.
they go dead.
Correct.
They're not happy with that.
Correct. Yeah, they're not compliant with that.
No, not at all.
Dr. Singh, so we'll stick a pin right there. We give him some good advice, but when we come back from the break, we're going to jump into how we could actually treat your gallstones. We have some nice options, including surgery, that we'll get into on the flip side of this.
Medical Associates Hospital is the only internationally accredited tertiary healthcare institution in the Caribbean for quality in medical care. Medical Associates' gold standard for quality medical treatment, culture of safety for patients and visitors, care based on leading, evidence-based best practices and compliance with international standards make us the leader in private hospital care in the Caribbean. Medical Associates Hospital, number one healthcare for the entire family.
Welcome back. So before the break, we were talking about the largest gallstone ever taken out. And as promised, we're going to talk to you about how we treat gallstones. So, Dr. Singh, typical treatment as a surgeon, you would say, take out the gallbladder.
Yes.
But I'm sure there are things we could do before that, before we reach to the stage of taking out the gallbladder.
Well, I mean, the gold standard treatment is a cholecystectomy, and how we do the treatment is via minimally invasive or laparoscopic surgery.
Now, just for everyone to know, a cholecystectomy is the removal of the gallbladder, which houses the gallstones.
Yes.
Right. Yeah.
Yeah, but I mean, in the past, I mean, medicine and traditional treatment, I mean, people would have tried different things. They tried dissolution therapy, where they will take tablets to try and dissolve the stones.
Does that work?
It works partially because we actually use it in patients sometimes who develop stones within the bile duct.
Right. Yeah.
Right, so it's stones within the bile duct. There are tablets that we can give to prevent it from forming, but it doesn't really work for the gallstone so much because the formation of gallstone, it's a little bit complicated.
And it's pretty solid once it's formed.
Yeah, and it's a imbalance between cholesterol,
Yeah.
bile salts, and bile pigments, and also the gallbladder itself, if it's diseased. So therein lies the problem. If you have a diseased gallbladder, it needs to come out.
Yeah.
Because you'll have recurrence of the gallstone. So the answer to that is no. I would say no.
Okay.
Yeah, so as a medic, right? I am a physician. I will see some of these patients first, So we take them through the steps of just having biliary colic or biliary pain,
Yes.
But then when the gallbladder becomes, I would say, complicated, is when I will call you and say, hey, Doc, I have a case, this is a patient, and I think the gallbladder needs to come out, right? As you say, surgery is the treatment option of choice to fix this, right? But when you have to tell a patient that, how you would navigate that conversation, like telling them, hey, you need surgery. That's the best way to do the surgery.
Yeah. Well, to prevent the recurrence of symptoms, you must remove the gallstones and the gallbladder.
But you can live without your gallbladder.
You can live without the gallbladder.
Right.
So how I express exactly the gallbladder, it's a storage organ really, and the bile is necessary to help digest fats. Now, removing the gallbladder doesn't mean that you remove the bile. What happens? The liver produces the bile,
All right.
and it gets stored in the gallbladder. And it's only when we eat all these nice fatty foods around Christmas time and other times is the gallbladder contracts and sends down a gush of bile into
your
the
gut.
small intestine, where it mixes up and it dissolves and gets the fat globules in the smaller one and helps the body to digest. So while the gallbladder being removes the symptom, it does not actually stop you from digesting fats.
Right. So Doc, like when you have like kidney stones, we could just take out the kidney stone and we just leave the kidney.
Yeah.
Why we can't just take out the gallstone and leave the gallbladder?
Right, so that's very, very interesting because in actually some parts of the world, like in China, where the gallbladder is actually seen as the seat of decision making, they have almost 20 years data where they remove the gallstones and leave the gallbladder. Now that's cultural driven. It's used in very, very selected cases in patients who have a normal gallbladder but may have a single gallstone. And the recurrence rate actually it increases, and it increases as time goes by, and it ranges up to about 33%. So the patient must understand that there is a chance that the gallstones could come back, but it is a common practice in mainland China.
So, Dr. Singh, isn't timing of surgery important as well with cholecystectomies?
Yes. As a surgeon, I would like to do a gallbladder that is not hot.
Right.
All
Because
right.
I was going to talk about hot and cold.
Hot
Yes.
meaning,
Yeah.
hot meaning like you
Hot
have
mean
an acute infection. or
acute
Yeah.
infection
It's inflamed.
with inflamed and pus. Because when you get in there with the camera, the laparoscope, the gallbladder is thickened and it's full of pus, and it makes the gallbladder very, very difficult to remove, and also increases the chances of complications. And the most feared complication of gallbladder surgery, and any laparoscopic surgeon or open surgeon, is common bile duct injury. All right, but I would prefer to do one that is not hot. So
Right.
if you have symptoms, don't wait. Or if you have gallstone, don't wait until it's acute, until you have abdominal pain and fever, and go to the emergency and try and get the operation done immediately. It increases the cost, it increases the time of the operation, and it also increases the complication rate.
Yeah, you've got quite a few risks with a hot cholecystectomy.
Yeah.
Things like increased infection rates, increased risk of bleeding, longer recovery time. Are there anything else?
Correct. I mean, if you do a what we call a cold gallbladder,
Yeah.
these patients could come in the morning and leave in the afternoon, and they on minimal painkillers, just one dose antibiotics. They back up and walk in by the afternoon, having a meal and everything. If you do a gallbladder when the patient is hot, meaning it's infected with pus, the patient may stay 2 or 3 days in the
Yeah.
hospital, have to get IV antibiotics, painkillers. So yeah, there are a lot of complications that can happen.
Yeah. So, how many cholecystectomies do you do on a yearly basis?
So combined with my public and private practice, I would say over 100.
100?
Yeah.
That's
Yeah.
quite a bit in Trinidad and Tobago.
In Trinidad and Tobago. No, for in my practice.
In your practice,
Yeah, it's
yeah.
about 100. And I will suspect that any surgeon who's working in private and public, numbers might be similar, because
Yeah.
it's a very, very common condition.
Yeah. But like as you say, as for a surgeon, it's almost like bread and butter surgery,
Yes.
to do. But you think we overprescribe cholecystectomies, or is it that we just really do it when we have to do them?
That's a very controversial topic, because
Is it controversial because you're a surgeon?
it is. But I mean, there are clear indications for cholecystectomies, removal of gallbladder. At the end of the day, you're subjecting this patient to an operation, and you should only do the operation if it's symptomatic. And the guidelines are very clear. If the stones are very small, less than 2 millimeter, if they're very large, greater than 2.5, if there are multiple gallstones, if there are changes in the gallbladder, if the gallbladder shows signs of inflammation, thickness, if there are any indication that there may be other things in the gallbladder, things such as polyp, patients at risk. Very large gallstones like the gallbladders, they are at risk for cancers.
Yeah.
So
Yeah.
any gallstone that greater than 2.5 centimeters should come out. Now, the risk increases with age. Anybody who's going to live a natural a life for more than 20 years, the risk of getting a gallbladder attack increases as time goes by.
Right.
So if a patient comes to me and they're a little older and they have a lot of comorbidities and they haven't had an attack because they would have done a ultrasound for some other reason, they have pelvic pain and they incidentally pick up a gallstone. I get a lot of referrals from physicians, and they come to me and they're diabetic and hypertensive, they're 85 years old, never had a problem. They eat all their doubles and the KFC, and the Christmas time they eat the pastels, and they have no pain.
They earn the gallstone.
Yeah, so I would not remove it. I counsel them on all the problems can happen, but no, I wouldn't take out a gallbladder in a person who's that old.
Yeah.
Now, if you're 40 years old, and even if you're asymptomatic, meaning haven't had problems, I would counsel you on removing the gallbladder in a timely fashion, because you're going to live for a long
Yeah.
time. and the risk of getting an attack
It's
is
still there.
still there.
Yeah.
Yeah.
Okay, so just hold that thought, because when we come back, we're going to talk to you about how you cope after having surgery, any complications, and how to enjoy yourself during this festive period. Stay tuned, we'll be right back.
Medical Associates Hospital is the most affordable MRI imaging center in Trinidad and Tobago. Patients have quick access to bookings and service, on-time appointments, high-quality, convenient, and fast scans. With $800 off all MRI scans, we guarantee we have the most affordable MRI service in Trinidad and Tobago. Medical Associates Hospital, #1 healthcare for the entire family.
Good day, my name is Dr. Laurent Olivier. I'm a breast surgical oncologist. Today we're going to talk about the breast mammogram machine. This is a tool that we utilize for breast cancer screening. It's the only recommended tool for breast cancer screening, which is actually what we call a 3D mammogram machine. Allows us the ability to take views of the breast at various angles, as you can see how the machine is moving left or right, and allows the computer to reconfigure a picture, a 3D picture of the breast. This allows us to pick up 25% more breast cancers and allows the false positive rate to be reduced by 15%. What that means, the ability to pick up abnormality is actually more accurate than the previous mammogram machines. This machine is readily available at Medical Associates, and the standard of care, which is mammogram machines for screening, is now starts at the age of 40. With the 3D mammogram, it allows us the ability to pick that abnormality and diagnose patients for breast cancer.
All right, welcome back, guys. So before the break, we were discussing about the surgeries and what we need to do to fix it. But with any surgery, there are risks.
Yes.
And we have to manage complications sometimes. What might be some of the common complications a patient who had a gallstone surgery or gallbladder surgery might encounter?
Yeah. The most feared complication of gallbladder surgery is bile duct injury. It does. The risk has gone down tremendously. And compared to open cholecystectomy and laparoscopic cholecystectomy, so it's less than 1%.
Right.
But when it does happen, it's a serious thing because it does entail more operations, more morbidity, pain, more interventions for the patient. It's not a quick fix.
Right. But doing the actual cholecystectomy laparoscopically gives some benefit to the patient. So there's a lower chance of encountering complications by doing it this way, correct?
Well, as we had refined laparoscopic surgery, yes. There are less risk of complications such as pain,
Right.
bleeding.
Right.
Patients they be able to sit up and get back to the normal activity within hours. They're up and walking, having things to eat and drink. Long time ago, when you did a gallbladder operation, you would have put a 15-centimeter incision on the patient's abdomen. That's really big.
Yeah.
And then the patient would spend almost 5 to 10 days in hospital before they go home, and
But
they get an ugly scar, a lot of pain.
That wasn't that long ago, that was about 10 years ago that was still happening, probably less.
Well, gallbladder surgery has been along since 90s. Hasn't come down to the Caribbean and popularized until maybe within the last 10 years.
Yeah.
But yes, some cases we still have to do open gallbladder surgeries. Remember, we were talking about the hot gallbladder. Sometimes we cannot get the procedure done safely by the laparoscope, where the patient can benefit from minimally invasive surgery. So you have to revert back to the open gallbladder surgery, but that is done to decrease any complications and risk. But 100% of gallbladder I probably do will be done laparoscopic, and in very rare cases we have to do it
To
convert to open.
So you no longer choose open cholecystectomies. You will always choose laparoscopic
Yeah, so the
first.
gold standard treatment is laparoscopic.
But now we're getting better than just a laparoscope, right?
Yes.
Because I see things in China and think men operating from in a little small room with a robot.
Yes.
And they sit down in their pajamas and they're in a screen and they go,
Yeah.
You ever handle a robot and
Well, we don't have any robots in Trinidad or
Not yet.
not yet, or the Caribbean. Hope to get robots soon. But yes, they have been doing gallbladder surgeries with robots in other parts of the world. It's very common in the United States and any first world country. In the UK, where I trained, there are robots. We used robots back then, but we don't have in Trinidad. They have actually done, you were talking about sitting in the room next door. They have done transatlantic gallbladders,
Yeah.
where the surgeon was sitting in France and the gallbladder was being done in New York.
Yeah.
And that was done way back then, almost 20 years ago. So it is the future.
That's special
And
stuff.
it's the way that things are going. Yeah.
It's quite interesting. You could operate from anywhere in the world. Before, we used to be somewhat envious, maybe, of a radiologist that could perform their duties anywhere in the world, but now surgeons could do the same thing.
Correct.
But let me get down to the crux of the matter, right? It's Christmas.
Yes.
Right? And there's the time of the year where everybody who exercise, who's diet and everything, they just forget about that for 2 weeks. Right? I mean, I be honest, I love ham. I love pastel. I will never say no to any food at Christmas time. Right? But a person who suffers with a gallbladder disease maybe can't do that.
No.
Right. So, what we'll tell them now? What you would tell them?
Don't forget alcohol consumption too, because that.
Well, I mean, I'll suggest to prevent the symptoms, the only two ways to do it is not eat any of those things or get the gallbladder removed.
Well, yeah.
So if you want to enjoy your Christmas,
Food
get your
or-
So you were
gallbladder
talking
removed.
about prophylactic cholecystectomies now.
Oh, no, not prophylactic. Get your gallbladder removed if you have gallstones.
Right.
I've heard people who have gallbladder disease. I mean, there's anecdotal. I don't know if there's studies or evidence to support it, but some people who's actually get the pain as soon as they think about eating some nice fatty foods. I don't know if this is in their mind, right? But at Christmas time, I just think about eating a nice ham sandwich, Christmas Eve night, pressure when the bread making, right? You're smelling it, you're feeling the festive mood, you had to get in that bread and ham and put your chow chow and
Pepper. You forget
as
the
a
pepper?
patient with a gallbladder disease, right, I know it'll be hard, right,
Yes.
to resist the temptations of, blazing through that kind of food. But, I mean, just a general advice to them, it's really about moderation, right? I just find it real hard to tell a patient, no, don't eat. You living in Trinidad, you have to eat our doubles,
Yeah, that's
right?
correct.
It has hurt me to pass my doubles, man, and to pop him or stop and check him once for the month, right? So, I mean, as a patient with this kind of problem, it's really important that we stress on, yes, sticking to a good diet, but, doing it in moderation. And, if it really finding that it bothering you and it causing these symptoms, you really, really need to check
Yeah.
and maybe get your gallbladder removed.
Yes, I agree. You won't get gallbladder pain when the gallstone gets stuck at the neck of the gallbladder.
Right.
So
Yeah.
you may have a history of pain while eating fatty foods, and then you may go for months or years, or
nothing.
sometimes just one day. So it's very unpredictable when you can get a gallbladder attack. But if you're getting recurrent attacks, it wouldn't go away.
Yeah.
And I would suggest get your gallbladder removed.
You brought up something very interesting about the gallstone getting stuck in the bile duct. I think I want to stress on the importance of not ignoring your symptoms and going and getting checked out, anytime the attack happens, because you just don't know if that's the time that it's stuck in the bile duct, and that causes a whole set of complications.
Yeah. Well, Doc, I mean, this was a really engaging discussion. I mean, there's something. Christmas time is a real dear time of the year for everybody.
Yeah.
It's a time to share, enjoy, and love, share happiness. But at the same time, patients must be cognizant of their health. And I would like to thank you for taking the time, to share your knowledge and expertise with us and patients at large. Yeah.
And we really appreciate you coming on yet again. I'm hoping we'll see you again next year. So thank you very much for supporting us this year. We really do appreciate it. And we wish you a very happy, healthy, and safe Christmas. All the best for the new year, and we'll see you in 2025.